Let's just take a moment and breathe. And let me just tell you something. No matter what you're dealing with today, no matter what kind of annoying shit you have to put up with, there's a way out for everything. And for things that are not a way out of, there is a lack of permanence. Nothing lasts forever. All the terrible stuff is going to end eventually, and your job is to just breathe through it and wait until the next point of relief. And while you're waiting, to be working on the best thing you can to help the most people you can and to find that center of the universe that we're always talking about. The Westminster Catechism that Protestants use, I think it might be a dishwasher. I don't know. I hate it. I wish I could ask someone to not do that. And if I knew what it was, I could ask someone to not do that. Goodness gracious, I hate that thing. I'm not a Presbyterian. But there are a lot of things that Presbyterians from the Reformed tradition believe that I agree with, or that are put in ways that I think almost anyone could agree with. And there is a place in the Westminster Catechism, I think it's the first question, where it asks, what is the purpose of mankind? And I think it is said to glorify God and John Piper, who is a pioneer of an idea called Christian hedonism, talks about this idea that God is most glorified in us if we are most satisfied in Him. Meaning, if God really is the center of all good in the universe, if there is this big creator above and outside of time, not just like some big, strong, angry dude like Zeus or Thor or whatever, but an actual, like, creator above all things, if that being exists, then it would be a very weak thing to have to serve them out of duty. Because if they really are the source of all good, then they're the source of all joy. They're the person who invented sex and orgasms and all those other kinds of things, and flavor and light and color. So if we are satisfied in Him, then He will be glorified. So then our goal is to discover Him and find the delights of Him. And He reveals Himself in many ways, through His word, but also through nature, through taste, through color, through light, through interacting with other people, all these different things. So when you help somebody else, the gleam in their eye and the gleam in your eye, He is there, right? That's the idea. So if that's the case, right, and you may not believe that that's the case, and that's all right. As always, you are still just as welcome. But if that's the case, then the thing that fulfills the Westminster Catechism, to glorify God, is to help others, to ourselves be satisfied and happy with God, to find the secrets and delights that are beyond comprehension. Your hair is different, bitches, again. It's very silly. So, just scratching your hair a little bit. So, all that to say, while you're here suffering with the rest of us, and we're dealing with this difficult suffering and this challenging world in which we are, right? While we're playing with that, the question is to find that thing, right? It's the Shema in Judaism, the central Shema. Shema Yisrael Adonai Eloheinu Adonai God and love others. And so while you're waiting and suffering and trying to survive the next step, none of this lasts forever. It's going to be over eventually. There's always a solution for that which is not over eventually, because nothing is infinite except for what has been made infinite by the divine. We are of infinite capacity in many ways. You're going to outlast the thing. And while you're doing that, love the center of all things and love others. Let me, before you go to work, let me do your heart exam. That was promised you. So, I forget sometimes that you have the chronic pain. And it's very hard to be working while you're dealing with that, my goodness. So just take some deep breaths. Yes, nice breath in and out. And I'm gonna go ahead and listen here to your aortic spot and your pulmonic spot and this your lower right sternal border, just your tricuspid spot, and down here to your mitral valve. And I'm going to listen on the side here to where your ribs are. And this time, can I have you lean forward a little bit? Just a little bit. While you're not very good at leaning, are you? Well, listen to the aortic spot again. There you go. Go ahead and squeeze your fists, and I'm going to listen to the mitral area again. Squeeze as tight as you can. Can I be real with you? Because I've been not in the clinic so long, because of my health recently, I'm really anxious about doing that again. Obviously, I keep up my skills. I still have my licensure and everything else, but it's something I'm really worried about. I get worried. So when I'm thinking and I'm listening to your heart, I'm thinking of all the possible things that could be wrong with it that I'm supposed to be listening for. I'm double checking that I don't have the aortic and the pulmonic spots switched, but I don't, because the aortic is the arch, so that goes in the front. That's kind of how anatomically you kind of remember that it's the one that's kind of shifted. And the pulmonic spot. It's just weird because you would feel like the four pulmonary arches should be more on the right, but it's just weird. And then listening to the mitral area, which is also where you listen for HOCM, which is hypertrophic obstructive cardiomyopathy, and having you squeeze your fingers, I have to think about the preload and afterload and the different things that cause the different, reasons. So aortic stenosis and HOCM can have similar sounds because they can put a murmur in certain places. And so that's why I have you squeeze, because I'm checking to see when you squeeze and create afterload with your fists, which means that you're putting pressure and pushing back against what the heart is trying to push out. Does that cause the murmur to get worse or better? Well, there's no picture for you. That's it. Nothing interesting. That's just what I was saying. Or when you do the hand grip, it's going to increase afterload, which is going to worsen murmurs that are, like if it's loose. If it's loosed, here's a good way to think about it. This is not what a valve is like, but say this is a valve, and you have a little flap, right? And at some point the flap is supposed to open and sometimes it's supposed to close. A regurgitation is what happens if the blood goes back through and it, like, instead of staying closed when the heart is squeezing blood out, right? So if I increase the afterload, your aorta, right, is sending stuff directly out the top branches of your aorta branches out here, and part of it goes down into your abdomen, and part of it goes up this way and branches up into your two carotids, right? That was actually the first time, my very first surgery. Carotids just stick out to me because my very first surgery I was ever scoped in on. It was a spinal surgery here in the back. And to get to the back of your spine here, in order to cut into it, because you can't cut through the vertebrae, you actually have to go through the neck. So the surgeon had gone through and moved all these delicate things out of the way to get in there back to that spine. And so she was all open, and her big hot blood vessels were here, her carotids, and I touched them. And it was my very first surgery. People always get a little dizzy on their first surgery, the surgeon told me, but I was just a medical student, and it was so warm. Like, normally you touch people's carotids and, you know, you get pretty used to finding that pulse, but it was so warm and hot and hard, aggressive, that pulse, because everything was out of the way. It was crazy. So, but anyway, that comes from your aorta. So your aortic valve, when stuff is coming out of it, if it's regurgitating, well, if the pressure after here is worse, right, that's going to make the regurgitation worse. That makes sense, right? It's going to be where, you know, and so then you'll hear a louder murmur during systole when you're squeezing, right? I don't think some other ones worse, but I think it makes pretty much most of the regurgitations worse. Mitral regurgitation also, ventricular septal defect. When I'm talking about a hokum, that's a disease young people sometimes have. The reason I say young people is because people die very young who have it. So if you've ever had a family member who died in an unexplained single car accident or unexplained drowning when they could swim, or they were just up and they just died one day, and it seemed like for no reason, then you may have a family history of hypertrophic cardiomyopathy. And in that, there's a problem with your proteins and how your heart muscle is laid out, so it becomes very, very thick, the wall. And so if the walls become very, very thick, you can imagine that makes a lot less chamber room, right? It's like this chamber versus this chamber, right, with these thicker walls. So that's a huge problem, because eventually your heart is trying really hard to pump the same amount of blood out because it's not filling enough during diastole, which is when your heart fills. And so if you're really filling, and so then it gets worse, because the harder your heart has to pump, the more the muscle grows. Just like if you pump a lot of iron, this muscle grows, right? Well, so it's pumping really, really hard to get this basic amount of blood out, and so this gets narrower and narrower and narrower. So we want those people to do less cardiac exercise, because we don't want their hearts to get thick. They're like people who shouldn't exercise very much, and they shouldn't do like sports where they would exercise a lot, like where they would do a lot of cardiac, because we don't want them to get so thick here. Well, so in that case, the reason you have murmur on systole isn't because of the valve, but it's because of these big, thick walls. And that murmur actually gets better because with the afterload being stronger, I'm pushing open everything. So now the heart has a better chance to pump, right? You think about it like a tube. If I shove water back up this tube, then this balloon will open up, and then there's more that can be squirted out. So that's what I'm thinking about and worrying about and stressing over when I'm practicing heart exams or showing you guys medical things. I'm thinking, oh my goodness, it would be so terrible, because I've seen people, I've fortunately not had any miss that like cost a patient anything, but I think everyone's had near misses, and I've seen misses that I've caught that other people had that cost patient things or that almost did. And so it's very scary because somebody's well-being is in your hands, and you could just not hear and miss something, or so many times you might be the one who did catch something, or you might be the person who did keep looking for something for a patient. But sometimes a patient will look totally fine, and there'll be this or that other thing that they just don't show you. Sometimes things are hidden. Sometimes somebody will have a tumor in a hidden place and it doesn't cause the right symptoms, right? That's why ovarian cancer is missed so often, because there's plenty of room there. So usually they don't have problems and actual symptoms until it's too late, until that cancer's already really big or even metastasized. So it's dangerous. It's a problem. So that's why people who have a family history with ovarian cancer should try to get regular pelvic ultrasounds, because you're not going to catch it otherwise. It's not like with a lot of other illnesses. It's why pancreatic cancer is so often so deadly, because it's caught so late, through no fault of anybody, except that we're not advanced enough that we know how to catch pancreatic cancer before somebody's already getting all the terrible symptoms, right? Because there's room there, so things can grow in hidden places and your body adapts and handles it. It's different than like if you get a brain tumor, you're probably going to notice pretty soon. It's rare if it doesn't show up because there's not a lot of space there, and you're going to get headaches if there's a mass pushing, right, on stuff. So it's like stuff happens. People die despite your best efforts sometimes. And I unfortunately do not have very good radical acceptance skills for accepting that sometimes. So it's a good side of me that I don't accept that there's nothing we can do. In my mind, there's always more we can do. So we're always going to keep trying. But negative about that is afterwards, sometimes there was nothing you could do. And how do you handle that? So sometimes you're up late thinking about all the different things. What if we could have done it this way? What if I had shoved this person aside and done this or that thing, right? You just never know, because sometimes then the outcome could be worse, right? Sometimes you intervening would make things worse. Prostate health is a good example of that. I think I've talked about that before, where there are prostate cancers that it's better if you do not catch, because they're not actually cancers. They're benign and so slow growing that as soon as you catch them, you're going to start to treat them, because you can't take the risk that they're gonna do something to somebody. But a lot of times the treatment for a very slow prostate cancer is worse than the prostate cancer itself. And so that's why we've changed screening guidelines now to be that we discuss it. We recommend it's a good idea to do a rectal exam on every male over 40 every year. But we don't do like a routine PSA all the time. We don't always do a blood test, right? Because a PSA is more sensitive, and you don't want to catch something that's not gonna, like, you have an 80-year-old patient and you catch something that wasn't going to kill him until he was 105. It wasn't even going to be a problem. But now that you caught it, you're going to end up taking biopsies, which means you're going to shotgun a needle into his rectum multiple times and to take multiple biopsies. You're probably going to do radiation. You might put iodine seeds up. They get seeded up under the perineum, basically. And so that you can burn the cancer away. Well, that also causes other prostate damage, and so now you've given the guy erectile dysfunction and a lot of pain. Maybe he's gotten an infection now because of you taking a biopsy through the rectal area, and this cancer wouldn't have bothered him even until he was 105, and he was going to die at 85, right, from something else. So sometimes you doing something can be worse. That's why there's the do no harm. So there's just a lot of I really hate thinking about healthcare, which is why it's a blessing and a curse to do some of these medical things with you guys, because it's good to make sure that I'm still paying attention to the education and other stuff like that, but it's also negative because it brings back all of these fears of all of these things that happened or could happen. I mean, I used to dream about my patients at night. I couldn't let go. It was just not possible for me to just let go. It was too heavy. It was like having hundreds and hundreds of children and never knowing when one of my children was going to die. It was the worst. So, I get very, I have PTSD diagnosed. A lot of people who, I've noticed in the civilian world, people who say they have, like in the civilian world it seems overdiagnosed, and then in the military world it's underdiagnosed because there's money that's associated with it, so you want to be careful about giving people diagnoses. So, oh, good for you. Stop drinking. That's good. Good job. Yeah, that's good. Congratulations. That's very good. That's awesome. Keep it up.